So I'd gather my equipment, which is already gathered. I'd perform hand hygiene. I'd provide privacy. Hi, my name is Eva. I'll be your student nurse today. Can I have your name and date of birth? Okay, and I'm verifying with their wristband. Okay, today I'm going to be cleaning and changing, I'm going to be cleaning your wound and changing your wound dressing, if that's okay. All right, and then I would make sure that the bed is locked and lowered, the patient's wearing non-skid footwear, the colleague's within reach, and that the side rails are up. That's my safety survey. Okay, and then I would check with the provider's orders. I would also check with our institutional policy of wound dressing, and I would educate the patient and teach the patient about what I'm doing, kind of what I did before, just teaching them that I'll be taking off the dressing, cleaning it out, assessing it, and putting a new one on. And then I would also address any of the patient's concerns or questions about the procedure. And then I would assess the pain, ask them on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you can imagine. Where would you rate your pain? And then I would assist them to a comfortable position. Okay. So now I'm going to perform hand hygiene. I'm going to don my gloves. Okay, and then I'm gonna unveil their wound with making sure that they still have their dignity and privacy elsewhere. And then when taking off the wound, I'm gonna make sure I use the push-pull method, pushing down the skin and pulling the tape at the same time, preventing excessive skin like tearing. And pulling towards the center of the wound. Okay. So before I discard this and before I discard these inner dressings, I'm gonna look at the amount and type of drainage that's in here. I don't see any drainage, so there possibly could be bloody drainage, purulent, straw color drainage. I'm not seeing any. I also would assess the odor, and I don't smell any odor as of right now. And then I would make sure to discard this and like where the institution policy, like where it is supposed to go. Now I will be addressing the wound. The wound, to me, it is there's mild redness when it comes like the actual skin. There is blood, but there's no pus, there's no excessive swelling, there's not excessive redness, which all can be signs and symptoms of like an infection. There's like no pus at all. And then the wound, the skin around it, the wound is mildly red, but that's normal or expected for healing. So as of right now, this wound is healing properly. Okay, and then now I'm going to measure the wound. So I'm going to measure the length. Should I say it is 14 centimeters? And then I'm going to measure the width at the widest part of the wound, which is about 2.6 centimeters. And then I'm going to measure the depth. This is where I would also look for any tunneling. Okay. So I'd use an applicator. I'd kind of push around in there, look for tunneling. I'm not feeling any tunneling. So then I'm gonna kind of put it in there, put my fingers right there. And I'm gonna measure it. I'd say it's about 2.5 centimeters deep. And then all of this stuff would be disposed if it got like this, and then if it got any drainage or blood on it, would be disposed properly. Okay, so now I'm going to take off my gloves and dispose of those properly, and I'd perform hand hygiene. Now I'm going to get my all of my stuff ready to clean the wound. So I'm going to get my gauze right here ready, and making sure I keep sterility. Okay. Making sure it's open. Okay. Take the whole thing off. Okay. I'm going to take some saline. Making sure she's nice and wet. Okay. So now, I am going to perform hand hygiene, done, new gloves, and I'm going to clean the wound. So I'm going to take one of the pieces of gauze and I'm going to put the corners together, like so. And I'm going to be cleaning from top to bottom and from the center of the wound to the outside of the wound. So at first I'm going to do a swipe, and it's going to be from top to bottom, and I'm going to be going in the, down towards the middle of the wound and then out. And then I would discard of this appropriately. And then I'm going to take another one and I'm going to clean one of the sides. So I'm going to clean the outermost side of the wound, making sure going from top to bottom. And then I'm also going to clean the other side. I'm doing the other side as well, top to bottom. Okay, so now it's all clean. I will be taking off my gloves that are all dirty from that, and I will perform hand hygiene, and then I will be donning new gloves to pat the wound. I would also, if there was medication ordered, I would do the 3 checks to make sure that's the right patient, right dose. I do that 3 times, and I would also go through the 11 rights of administration as well. Okay, so I'm going to take my gauze pads here, and I'm going to fold them long ways like this. I'm going to insert them into the wound, making sure that it really gets in there. If there was more drainage or more bleeding, I would make sure to put more. But these 2 should work for this wound because there's not much drainage. Okay, so that seems pretty good right there. And then now I'm going to take this covering, and I'm going to make sure blue side is up, and I'm going to put it down on top of the wound, and I'm going to take my tape and I'm going to place it onto the wound. I'm going to make sure that I kind of put as minimal amount of tape on the skin as possible to avoid, I don't know, further damage of the skin around it. I'm also going to be doing it in a window pane taping to make sure that everything is in securely. Okay, so now that's all on there, I'm going to take off my gloves, perform hand hygiene, and then on a piece of tape, I'm going to write my initials. I'm gonna write the time, which is 13:41. And I'm gonna write the date, which I'm pretty sure is the 12th. Yeah, so 3/12/25. I'm gonna take this piece of tape and I'm going to put it onto the dressing. And then I would monitor and assess the patient's response after the dressing change. And then I would also document that I did this procedure. And I guess I could show you the wound dressing. Okay. All right, thank you.